There are so many complex factors that can result in medication errors. I want to talk about two of them. I'm Pat Iyer, a legal nurse consultant who has analyzed medication errors cases for 28 years. First, I want to talk about medication administration workarounds. They can easily lead to medical errors. Healthcare providers use strategies to bypass some of the safety features of the medication administration system. You may have heard about the Wisconsin nurse several years ago who was involved in the death of a 16-year-old pregnant mother. The nurse gave her an infusion intravenously that was ordered for the epidural route. The reason this happened was tied back to the computer system because there was a barcoding system that the nurse bypassed. The nurse did not place an identification band on the patient as required by the barcoding system to select the right drug. The other nurses in this department also collectively deviated from the protocols. The department training on the software had been suboptimal. All of the nurses seemed to think it wasn't urgent to follow the barcoding system because it felt cumbersome. The result was a patient death. In another healthcare system, nurses used a software system for medication administration. A blue pill icon became red if the medication was not given, even if there was a reason for it to be held, such as awaiting lab results. The nurses didn't like seeing that icon showing up on their screen because they felt it reflected poorly on their practice. So they noted that the pill had been given to make the icon disappear. The result was some of the medications that were being held were not given at all. Next on my list is medication reconciliation. I've seen many cases in which a medication was inadvertently missed when a patient went from a hospital to a continuing care facility. It should have been ordered, it wasn't, and then after the patient was in the new facility for many days or weeks, the impact of not receiving that medication became apparent through a change in the patient's condition. Medication reconciliation may fail because a nurse took on the role supposedly to be done by a physician. Suppose the physician started the discharge process early and missed critical information. The physician may not have done a medication reconciliation. It's important to learn during discovery how the physician had ownership of the medication reconciliation process. Were there policies and procedures and standards in place that spelled out what happened if a physician did not perform that step? Did the nurses fill in for the physician? The physician is to do the medication reconciliation. Did he or she push it onto the nurse because of not wanting to do it? Did the doctor leave the hospital without completing it? Did the nurse try to go through the process on the phone with the physician? It's a very dangerous situation. Nurses are not to do medication reconciliation. It's the physician's job. Analysis of medication error cases starts with defining the damages. If the patient is sufficiently injured by the medication, then it's time to look at what caused the error. Dangerous workarounds and not properly reconciling medications can lead to errors. A legal nurse consultant's knowledge can be invaluable in these situations. Be sure to stop by legalnursebusiness.com to check out our resources for legal nurse consultants.